In a new Republican effort to repeal the Affordable Care Act, Senators Lindsey Graham of South Carolina and Bill Cassidy of Louisiana have released a plan that would essentially allow states to come up with their own health care plans using a federal block grant. The grant money would replace federal dollars currently being spent on Medicaid expansion and on subsidies to help people afford insurance under the health law, also known as Obamacare. All of this funding would expire in 2027. Like earlier Republican health care overhaul bills, the new bill would also make permanent, structural changes to the Medicaid program for beneficiaries who qualified before the expansion, converting it from an open-ended federal health care program to one that caps federal spending on each beneficiary. How the bill would alter major parts of Obamacare. Obamacare changed Medicaid's eligibility requirements to allow more people to enroll if a state chose to expand the program. The federal government pays at least 90% of the costs for newly eligible beneficiaries. Senate bill. The Cassidy-Graham bill would repeal Medicaid expansion, and instead it would create a big block of money for health coverage that states could use as they saw fit. The money would be used for residents who are currently eligible for the Medicaid expansion or the Affordable Care Act markets. Money would be redistributed among states using a complex formula, and the funding would expire entirely in 2027. Overall, states that expanded Medicaid would receive less money than they would under the Affordable Care Act. Senate bill would repeal the subsidies in 2020. States could use money from their block grants to lower cost sharing for low-income beneficiaries, but they would not be required to do so. Obamacare gives tax credits to middle-income Americans to offset the cost of premiums based on their income and the cost of insurance in their area. Senate bill provision would not technically be repealed, but the caps would be less meaningful in states that pursued waivers and did not choose to guarantee coverage for essential health benefits. That's because the annual and lifetime limits and essential health benefits are interrelated. Senate bill. The requirement that insurers must cover people with pre-existing conditions would not be eliminated everywhere, but states would be able to obtain waivers to charge different premiums based on health status. Such waivers would effectively eliminate Obamacare's protections, since people with prior health problems could be priced out of the market. Restrictions on charging more for older Americans. Obamacare bans insurers that sell policies directly to individuals from charging their oldest customers more than 3 times what they charge their youngest ones. Senate bill. While it would not eliminate the restriction, the bill would allow states to obtain waivers that let insurers charge different premiums based on age.